Now, let us come to here now. The last concept of this chapter, life process, is called as renal failure. The renal failure also we can call it as what? Kidney failure. Do you understand all of you? So now let us discuss what is this kidney failure, and if suppose our kidney fails, then what kind of technology is available at present for the survival. That is what our concept. So now coming to here, renal failure and the technology for survival. What is the technology? Survival. This is what the important thing. So now let us come to here. Sometimes a person kidney may stop working because of some reason. Maybe it is because of age, or maybe because of even a small age itself. You can see, even my village, I have seen some cases, 2 kidneys has been failed. Even for my seniors, just 1 or 2 years elder than me, they have been affected by 2 kidneys have been failed, and they have been transplanted the one of the matching kidney of father. So father has been donated 1 kidney, so that with that 1 single kidney to each one kidney, they are surviving now. So we cannot say which age it has been going to affect, either only at the lower age or upper age, and etc. etc. And one more fellow you can see, I will say the open it is which has happened. Just I want to say the real life experiences of mine. One of the fellow in my village, usually he's a farmer. He's also our senior, my senior only, but usually he, after 10th he has been not studied, so he is usually agricultural, some farmer. So he used to cultivate the tomato. Do you know tomato, all of you? Yes or no? So actually the of the tomato is 3 months basically. So the 3 months to 5 months it will come. So he has been cultivating this, and he used to every day keeping the water for it. So while he is means supplying the water to it, what he has done means he has been ate more amount of tomatoes. You may notice that for girls it is not the problem, but the gents consuming tomatoes is harmful, very very harmful. You may notice by this time brinjal, tomato and all, because the seeds thickness, the seeds which are present inside this brinjal, tomato and all, you may notice it very very thick, less ml. Is it yes or no? Very very less ml. So what will happen means basically, particularly for gents, these kind of one, if our kidney is unable to filter, unfortunately this will entering into inside our kidneys, and they will be turning into, we used to call it as what? It will be only turns into stones. You may notice it. Kidney stones you may heard. Have you heard?
Yes, sir.
This is what we should do. So like this filtered, which the unable to filter by the kidneys, these substances, they will be stuck inside the kidney, and that is what we should call as stones, the stones formation. He used to eat more and more tomatoes, just you won't believe. You imagine how it is possible. After completing, means after completely harvesting this crop, after 5 months, he has been affected with a kidney failure, and they have been tested that already 70 stones has been formed because of this. Actually the problem is from beginning, he has not been noticed, but because of this tomato consumption more, that all the kind of seeds has been stuck inside, and they have been converting into stones, and he has been operated both the kidneys just after 5 months of this tomato. That much affected. Very very dangerous, and very most sensitive and most prominent one in our body is kidney only. So you can able to observe very carefully. If heart will fails, or else if you are getting heart stroke also, now we have a better treatments, and even cost of, suppose you can see, if your heart will fails, maybe one time you can go for surgery, it will comes to like 6 months, or even 5 years, 6 years, again later you can survive happily by taking small care, correct? Yes or no? If heart will fail, or liver will transplantation or not. But kidneys, you can see, kidney will fail, then every day it will be like a horrible situation. We will be in hell if the kidneys will fail, because no unwanted substance will filter by our body. So everything will be stuck inside our body, like along with the blood, so that no blood proper circulation, and finally even it will lead to the death also. You may see so many kidney failures, they will used to die. Have you heard or not? Yes. So now,
Yes, sir.
that is why we should know. And even the dialysis cost is also very, very effective, more cost effective. Correct or not? and every week or every month we should go with the dialysis process. What is dialysis? We will study. So the dialysis also very complicated process, and cost also very high. That is why so many kidney patients, they will face much problem. That is why my best suggestion, I'm saying you, whatever the age, according to your age, averagely how to take to get free motion. If you are not getting the free motion, then definitely you have some problem, indigestion or something problem. Kindly all of you please drink at least minimum 4 to 5 liters of water averagely. Consumption of more water also are harmful to our body, but consumption of less water is more even dangerous than consumption of more water. Averagely, you have to, as whatever you are, so liquid water should be consumed by minimum 4 to 5 liters. Then only our blood, our kidneys will get enough sufficient. Understand? Means they will filtrate the blood much faster, and they will be cleaned up very process. You may notice it. If you want to clean anything, you want to use water only. The same thing. If you want to clean the unwanted substances, our body should consume minimum level of water every day, and then only you people will get free motion. You can see if you go to the bathroom, immediately it will be. If not, you have to be some kind of problem in the free motion also. That is why averagely you have to consume minimum 4 to 5 liters. Do you understand, all of you? By consuming 1 liter, 2 liters, it will lead future you guys going to face much problems in future. That is why please kindly consume 4 to 5 liters, and particularly gents, I'm saying you, in our Tamil Nadu particularly, consumption of tomatoes is too much of high. Is it yes or no? I am seeing everywhere, sambar, rasam, and etc. Everywhere people will keep tomato, and brinjal is common vegetable in all the sambar and all. Don't consume the brinjal which contains a developed seeds, and as well as you just request. I know that already most of your parents know. Tomato, while you are using tomato, at least remove the maximum amount of seeds, and then you can use for our cooking process or something. That is better as a safety of your parents. Like girls, if you take, it is the safety of your brother, the safety of your father, safety of your grandfather, etc. So you have to remember these things. These are the, at least remove the well-formed seeds and all, because it is very dangerous. We don't know for whom it is going to be settled in the kidneys and whom it is going to be damage the kidneys. That is why. So let us come to here. What is this? Our concept called as renal failure. Also we used to call it as what? Kidney failure. So if the kidney will fail, what is the technology is there for survival? And if there is no kind of technology, then what will happen? That is what we will going to study now. So if it comes to any kind of person, sometimes the kidney may stop failure at any age, maybe even lower age or middle age or upper age, whatever it is. Like in once you will become old, but most probably most of the old age people will face this dialysis problem. Like because of sugar, they maybe get some other reasons and other things, etc. So most of the old age people only they face this problem, but it is can come any stage. The kidney may stop working. So here, the infection in the kidneys or else why this kidney will stop working? Why can't it will work continuously? Maybe some kind of infections, like what I said, like formation of stones, or else some accidents. Due to some accidents, may our kidney injury, or else because of high BP. High BP. What is the meaning of high BP? High? Tell me, high BP means what?
Blood pressure.
Blood pressure.
High blood pressure.
Why the kidneys are failures? Why the kidneys may stop working? Because of infection of kidneys. Infection in the kidneys, you can write it. Or infection of kidneys. Reasons behind it. Please note it down. Reason behind for kidney failure or kidney may not may stop working. What is that? Infection in the kidneys. Next, injury to kidneys. An injury to kidneys. Next one, a very high blood pressure, very high BP, blood pressure. Next one, another one, opposite to BP, one more problem is there. BP is related to the salt and all. Another thing, sugar related, what you should call? High blood sugar. Understand all of you? That is what? Very high blood sugar. High blood sugar means glucose content is more in blood. That is. Next one, restricted blood flow to the kidneys because of some kind of fat will form in the renal artery and the renal vein, so that blood may not pass well to the kidneys. That is also the problem. Restricted blood flow to the kidneys. Restricted blood flow to the kidneys. So
Okay.
if you'll observe, these all are the maybe a reason. Some of them also a common reason for the kidney failure. So you can see here, can damage the kidneys. This all the reason. Maybe some infection or maybe some accidents, injury, or very high blood pressure, very blood sugar, and or else maybe the blood is not supplying to the kidneys well. So this because of this all, they can damage the kidneys, due to which the kidney will stop. What is happening, Raj? Stop working. Do you understanding all of it? It may be the reason of this above anything. So now here, you may observe here, because of this one, and still you are not facing. Suppose if you are getting continuously pain in the kidney area and you are not caring it, and you are not going to the hospital, then complete failure, it may lead to the complete failure of our kidneys, and it will allows the urea and other waste products to build up in the blood. So if the kidneys are not working, you can able to see here that all the urea and all the unwanted substances, they will be again stored in where? They will be stored in blood only. Do you understanding? So this all the unwanted waste products will be reformed into the blood. So even the amount of water in the body is not even regulated. Whatever it is required to our body has been increased much again. There is no control of water also in our body. So that may causes even death if you are not going for the treatment, or if you are not noticed the problem of this kidney failure. It may lead to the death if the patient is not given immediate treatment. Do you understand, all of you? So because of these problems, these all above reasons are the causing for what? They are the causes for stop working the kidneys. That is only we used to called as renal failure. Kidney failure. So if you are not giving immediate treatment for these failures, then the patients will definitely will die. So what is this called as? So the best method of renal failure, the kidney failure, is just transplantation. So if you transplant the kidney, if the kidney will fail, then if you transplant the kidney, that is the best method of replacing the kidney with another matching kidney. But simply I can take like movies and all, don't think that simply somebody will come and they will give the kidney and all. So some even funny movies you can see in particularly Telugu Tollywood films, you may notice it in Tamil also, it may be dubbed. Some kind of artificial kidneys, artificial kidneys also there now, but matching with that particular blood group and that particular person is very, very important. If not, again immediately he will die. So now that is why you can see, while somebody has been kidney failure, they may most probably check the father and mother kidney, because even father and mother kidney also, it may be not going to be a match with the particular person if he is having a kidney failure. You may notice that is what I said in my village. One of my elder brother, he has been affected with this kidney failure. Both the kidneys failed, so that his father has been came forward to donate the one kidney, and now both are surviving with a single kidney. They cannot do any kind of work themselves, and they cannot even sit fastly. So many restrictions will be there, because already they are having only one kidney. One kidney only need to do the functioning of both the kidneys which they have been done before. That is the reason. Now, the best method of renal failure or kidney failure, what is that? What is the best? Like a complete long-term solution, we can say. So the long-term solution for the kidney failure or renal failure is what? Kidney transplant.
Dialysis.
What we should call? Not the dialysis. Dialysis is not the long-term solution. So kidney transplant, all of you should remember. Kidney transplant is the long-term solution for kidney failure. So in this picture, you may observe something. What is this called as? Have you noticed it?
Kidney.
What is this called as? This is called as kidney. Doctors are doing it. You may notice it. It is in the doctor's hand. Correct or not? So what the doctors will do with that? What the doctors will do that? Kidney is prepared. Understand? If it is the kidney has been prepared for transplant operation. Do you understand kidney transplantation? You may heard it. Have you heard a word called as kidney transplantation? Yes. This is the
Yes, sir.
kidney which has been getting prepared for transplanting the person by operation. So you can see, that is why you can see in the second picture, one grandmother is there. She has been, you may notice that something is passing to the mission. This mission is called as what? Dialysis. Is it as?
Dialysis.
Understand what is this dialysis? How this mission will function? That is what we'll study. It is not an issue. Now you have to remember this one. So what is the long-term solution for kidney failure? What is the long-term solution for kidney failure?
Kidney transplant.
Kidney transplant. That is what you have to remember. So here, whatever the damaged kidney, maybe because of some reasons, because of some infections in kidney, or maybe what? Because of some injuries to the kidney, or because of high blood pressure, or because of high blood sugar. And also, what is the reason? Somebody making noise.
Restricted blood flow.
Okay, and also maybe the one more reason. What is that reason? Restricted
Restricted blood flow
because of this.
for the kidney.
If our kidney will stop working completely, then the better way is to go with the transplantation. That is why you can see organ donation is more important after our death. That is what the government is trying to create the awareness also. Because even we may die, but with our organs, some other people, they may get a good life. That is what you have to remember. So that is why even see present generation, so many educators, they are coming forward to sign for organ donation. So within 24 hours after our death, our organs has been collected and they can see they can be transplanted to another needy persons. Within that 24 hours it has been done. Definitely it will be useful. Our organs is not going to be wastage no more. But as we know that in our Indian ethics and so many cultures and all, so that even cutting the body post-mortem itself, even we will treat as a something like a very big thing. So many may not come forward because of the fear and all. So after that, whatever it is, what we will do, nothing will be there. So that is what I am saying. So the best method of the long-term solution for kidney failure is what? Kidney transplant. So what they will do in this kidney transplant means, remember, so whatever the damaged kidney, they will notice it and they will start identifying they will remove it first. The damaged kidney is removed and they will try to find the kidney. Is it any kidney can match or only particular kidneys? So it is not that all the kidneys will match to all the particular persons, because blood group and so many etc. That is what the matched kidney only they can do the transplant. If something they will do, then it may lead to the immediate death also. So that you can see all of you. So the matching kidney which is donated by even some kind of a long-term diseases and all, it is not accepted. So the kidney transplant only will done by it has been donated by what? A healthy person who is having some kind of permanent diseases and all, it has not been accepted. Okay, so only the person who is having healthy person, if he will donate the kidney, then it has been transplanted to a person who has been affected with the kidney failure. So here they will matching kidney donated by healthy person is transplanted in this place by surgical treatment, or we can call it as surgical operation. Surgical operation or surgical treatment. So in the picture I have shown you already, that is a kidney which is ready for what? Ready for
Kidney transplant.
correct. So here if you'll observe, one more thing, if the kidney transplant is not possible due to some other reason, you can see that. So maybe the kidney is in our relatives or in our parents, our kidney may not match few times. Or else you are in a extreme, means almost in a 80 or 60 or 70 years. So by the time nobody is come forward to donate the kidney to you, or else it is not matching, or else if they are having some kind of other reasons, like that donor is having some other kind of diseases, so that it is not possible to transplant the kidney. So if not transplant if it is kidney is not transplanted, then we cannot survive long period of time, because we have to go with the alternative treatment. If the kidney, actually the long-term treatment is kidney transplant, but if that situation, if it is not available and it is not going to be fine, then what we people do, we have to go for the alternative treatment. Correct or not? Suppose then the patient, if there is no kidney transplantation, he may be leads. So it may leads to the death also. So that is why what we have to do means, if not possible due to some reasons, then patient with kidney failure is treated every regular interval of time. You may notice it. Some of your relatives also may be there. Every month they will go for dialysis. Have you noticed it? Every month regularly they will go for filtration of blood. Yes or no? That is what we should call it as dialysis. So, if the kidney transplant is not possible, then the patient with a kidney failure must be treated periodically on a kidney mission. That kidney mission is only called as what? What we should call? Dialysis.
Dialysis.
This kidney mission, what it will do means, it can do the work of damaged kidneys. So whatever our kidneys will function, same way this dialysis mission will function, and it will remove all the unwanted substances by some process. What is that process? What is the physics behind in this dialysis? That is all we'll study. So now, renal failure or kidney failure, please all of you write this point. What is the causes of renal failure or kidney failure? Totally 5 causes will be there. That is maybe infection in kidneys, or next injury to the kidneys, or high blood pressure or very high blood sugar, or because of something blocked in this renal artery and renal vein, so that restricted blood flow to the kidneys. This is the reason. So this is what the causes of kidney failure. So what is the treatment? Treatment, we have 2 treatments. One is long term and another one is periodic treatment. So what is the long term? First one, write it. The best long term solution.
Kidney transplant.
The best long term solution for kidney failure is the kidney transplant. This is the first thing. But some other reasons, if it is may not transplant, then what we have to do? A patient kidney failure is treated with what? Second reason.
Dialysis.
Treated periodically with what? Treated periodically on a kidney mission. What is the kidney mission called as? What is the kidney mission called as? Dialysis.
Dialysis.
All of you write it. So what is this dialysis, and whatever it is, we will study in the next class. So that is why you can see. So what is the functioning of dialysis? Can you able to say? Just now I said. What is the functioning of dialysis? They will do the work of what? They will do the
work
of damaged kidneys. That is what you have to remember. Work of damaged kidneys. Dialysis will do or can do work of damaged kidneys. So that is why you can see the kidney mission, even sometimes what we can see, it is prepared by humans. That is why man-made, it is not natural. So actually kidneys are natural filtrate of our human body. It has been done by our body only. We are not doing anything. But it has been done by, this dialysis has been done by our humans. That is why what we should call this one, if it is natural, we should call it as kidney. If it is done by us, then what we should call it? Artificial kidney. What we should call?
Artificial kidney.
Artificial kidney. You may remember. Why? Because it will do the function of what? It will do the work of damaged kidneys. That is why we should call it as artificial kidney. Please all of you remember. And here you have to write. They will ask you for one more question or one word also. What is artificial kidney? Please write it. Question. What is artificial kidney? What is artificial kidney, Ra? Anybody? Dina?
Human made to do the function of damaged.
You have to write sentence formation, right? An artificial kidney is a device. An artificial, what it will do? It will remove all the unwanted substances. Is it yes or no? Like how the kidneys are doing. The same thing they will do. That's all. Nothing is there. An artificial kidney is a device An artificial kidney is a device. An artificial kidney is a device to remove water. To remove what it is? Nitrogenous waste like ammonia. Nitrogenous waste products from whom? From whom it is removing? Products from which has been deposited where? If the kidneys are not filtered, then all the waste products will be deposited in where? Deposited in blood. That is what you have to remember. Nitrogenous waste products from the blood, through dialysis. Through dialysis. This is what. Please all of you write it. So on what is dialysis and what is the dialysis mission alone? Actually, it is little bit important for our higher classes also. So just dialysis mission and dialysis we will discuss in the next class, and immediately next class we will start the revision for our coming PT exam. So with this I will stop the today's class. Till here any doubt anybody, please kindly ask. Please write it. What is dialysis mission? Artificial kidney. It may coming in our school exam also. Remember, because now it is not MCQ correct. So please all of you write. Dialysis, artificial kidney. Have you done? Any doubt anybody till here? So now here I am saying you have to learn two diagrams in this excretory system. What is that? Most important diagram. Definitely one diagram may have chances to come. What is the first diagram? All of you, even board exam, whatever the exam, two diagrams you have to learn. What is that exam? What is the diagrams? Can you able to say? Human excretory system. What is that called as? Human excretory system. What we should call it as also? Also called as urinary system. Do you understand all of you? This is the most important diagram which have to be practiced minimum 10 times. Already I have taught you. Next, if it is missing, then what the second diagram will come? A diagram to show working of human excretory system. That is what we should call it as what? Working of human excretory system. What is that called as? Please tell me. Human excretory. What is this known as? Human excretory system called as? Nobody. Nephron. So these two diagrams, definitely one diagram will come in our exam. So please practice these two diagrams kindly. So two diagrams you have taken screenshot. I have given you the pictures also, correct? So you don't need to go anywhere and you don't need to go search anywhere. Just follow these pictures and draw well in our classwork also. Whatever it is, you learn only one diagram. So which I am giving you is more even clear, and it has been well mentioned the parts and all. And I hope if you learn the diagram, you can able to explain the full process of that. Is it yes or no? That is what we are studying step, correct? So that is what they want in exam also. And mainly I'm saying most of the people will lose the mark for diagrams only in biology. I have noticed it. So please kindly practice well, and you have to learn well these diagrams to perform better in our exams, because that exams we need to write well. So as you know that what is the importance of it. Yesterday only I have explained it. So don't neglect any subject. So carry on with our preparation.